So now I'm going to assess my patient. I don't have a live patient tonight, so I'm going to be assessing this girl here. I'll be doing her GI system. So the first thing I would want to do is have her lay at a 30-degree angle, and I'd be looking here to see if I saw any aortic pulsations. Sometimes with slimmer people you do, with more obese people you don't. Or if there's an enlarged heart. I would hope that I didn't see any peristalsis here. I'd be looking at her abdomen. I'd be looking for scars, adhesions, discolorations, bruising. I would look at her umbilical area and see all that was normal and intact. Then I would take the bell of my stethoscope and I'd be listening for bruits in her belly area here. I'd first start out listening to bowel sounds, and I would want to listen in all 4 quadrants to see if they were active or hypoactive or non-existent. If they're non-existent, you'd have to listen for about 5 minutes to prove that. Then I'd be listening for bruits in her iliac and femoral areas. I'd be listening here and then in her femoral, both sides. Then I would be palpating her abdomen, and I'd be palpating all throughout here and noticing if she was grimacing or if she was guarded. She would be able to tell me if she was feeling any tenderness or pain. Then I'd do a deeper palpation where I'd go in with both of my hands and I'd push in all the areas, feeling for masses, and I'd again feel in all 4 quadrants. To find her liver, I would find the bottom of her rib cage, and I'd use a hooking technique, and I'd feel right under the ribs to see if I could feel for the liver. In some people you can if it's enlarged. If it's not enlarged, sometimes you can't. And then I would be feeling over here for the spleen. Again, you probably wouldn't feel it unless it was enlarged. So you would either say it was palpable or non-palpable. Then I'd be doing percussion to feel what the different sounds were. A lot of it would be tympanic. You could hear it. It would be sort of hollow. You do it like that. In a person, obviously, it wouldn't be like that. As you go down to the lower abdomen and the lower quadrants, if there's stool in there, you might hear more of a dull sound. And then you'd start percussing the liver. When you'd start up in the ribs a little bit, you'd hear it more tympanic, and then as you got down towards the liver, you'd hear more dullness, and that would be the top of the liver. So if you want to measure the liver, you percuss down until you get to where the top of the liver is, and then you could put a mark there with a pen or an eyeliner or a piece of tape if you were doing it through the clothing, and then you'd start in the bottom and then you'd percuss up until you got dullness. And then you'd measure that area there. And to start, when you go down, I forgot to mention, you go mid-clavicular. So you'd find the middle of the clavicle and go down through the ribs that way. And then you'd go up the same way, and then you'd measure that. And it would usually be 8 to 12 centimeters is what you'd find as the normal width if it was not enlarged. Then you do the same thing on the other side to find the spleen. You don't necessarily have to measure for the spleen, but the spleen is usually between the 6th and 4th ribs. You'd percuss for dullness. Again, you'd be listening for that. Trying to think what I might have missed. I think that's pretty much it. Let me look at my cheat sheet really quick just to make sure I got it all. So yeah, I palpate the spleen, I palpate the borders of the liver. I would, as I talked about before, I'd palpate deeply for tenderness and masses, and I'd be checking for muscle tone, and sometimes people have a split muscle there, especially after childbirth. Sometimes it would be hard if it was pregnant. You'd assess for ascites and things like that. And I think that about covers it. Thank you.